I'm Michelle Crouse. I'm a primary care physician with Prisma Health. I grew up in South Carolina. I actually went to med school in Charleston and then spent a little bit of time in New Orleans for residency. Came back to South Carolina because I still have family here, and as they get older, it's important to me to be close to them. I chose to go into internal medicine because I really liked being able to see the whole patient in their entirety. When you do primary care, you really get to know your patients really well. And for me, that's one of the best parts of the job, is forming a close relationship, finding out what matters to people and what they really value, and being able to influence their health in the long run. I got into geriatrics because in a way, it's an extension of primary care, and so it does include all of those features that I like. But I recognize within my own family the special needs of older patients and just really how they need a different kind of care. Many of them are struggling with depression, isolation, lots of health problems all at once, and a lot of them start to deal with issues related to independence and memory. And so being able to help guide patients through that process is something I really enjoy. The thing that keeps me most interested in my work is 100% getting to know the patients. Forming relationships is really the best thing about primary care to me, and just getting to be in it with people for the long run is something that I really love about my job. So within geriatrics, I place a lot of emphasis on identifying what's important for each patient and what their goals are as far as healthcare and just their living their lives. Particularly for my older patients, encouraging socialization, healthy eating and exercise is going to be super important for keeping them independent in the long run. And for younger patients, just emphasizing healthy habits and things that are going to put them on the road for success as they age are things I really try to do in my practice. I want my patients to always feel like they're heard, that their values matter, and they're respected. And so I want them in the driver's seat as we navigate healthcare. Outside of work, I have a variety of interests. For a long time, I practiced different types of martial arts. The thing I do mostly with my spare time now is just spend time outside. And a place I spend a lot of time is in my backyard. I have a little vegetable garden, or actually a decent-sized vegetable garden back there. And the newest addition are 3 chickens who I'm hoping will be laying some eggs in the near future. One aspect of advice that I give my patients is come in as yourself. I want my patients to feel very comfortable just being who they are with me, bringing up any concerns that they might have. You should never feel judged in my office. You should always feel like whatever you have to say is important. And any concerns you have are going to be heard, and we're going to work through them together.